Anterior arm and cubital fossa. So first let me mention something about fascia. The brachial fascia, which is also called the deep fascia of the arm, is a sleeve of connective tissue which is continuous at its proximal end with the pectoral fascia, which we have already encountered in a previous video, and the axillary fascia, and also the deep fascia that covers the deltoid and latissimus dorsi muscles. Distally, this fascia is going to be continuous with the antebrachial fascia, i.e. the fascia of the forearm, or the deep fascia of the forearm. Brachial fascia is then connected to the medial and lateral sides of the humerus via intermuscular septa. I'm going to show these to you on the next slide. And this also creates two compartments, which would be the anterior compartment, or the flexor compartment, and the posterior compartment, the extensor compartment. And here you can see the lateral and the medial intermuscular septa. And looking at the compartments of the right arm from inferiorly, which is the standard view for cross-sectional radiology, we can see some of the muscles in here. Actually, there are three muscles in the anterior compartment, two of which we can see: the biceps brachii, the brachialis, and not seen here is the coracobrachialis. The posterior compartment, which is the extensor compartment, we can see, well, three heads of one of the muscles in here, which would be the lateral, the long, and the medial head of the triceps brachii. Quite intuitive here that triceps means three heads and biceps means two heads, because it actually has a long and a short head. The nerve of the anterior compartment of the arm is the musculocutaneous nerve. The nerve of the posterior compartment of the arm is the radial nerve. So although the elbow joint appears pretty simple because its primary function as a hinge joint, the fact that it involves articulation of a single bone proximally with two bones distally, one of which rotates, in this case the radius, confers a surprising complexity on this compound three-part joint. The hinge movement, so the ability to transmit forces, and the high degree of stability of the joint primarily result from the conformation of the articular surfaces of the humero-ulnar joint, which occurs between the trochlear notch of the ulna and the trochlea of the humerus. The maintenance and integrity of the humero-radial joint, so between the humerus and the radius, depends mostly on the combined radial, collateral, and annular ligaments. The annular ligament is a ring-shaped ligament that surrounds the head of the radius. This is why the head of the radius can actually rotate while you pronate and supinate your forearm. Because of the rather weak association of the head of the radius with the trochlea, the head of the radius can actually be pulled out. This results in subluxation and dislocation of the head of the radius. This happens particularly frequently in preschool children, and it's also called nursemaid's elbow or pulled elbow. And it happens when the child is suddenly lifted up or pulled by the upper limb while the forearm is pronated. The child will then, of course, cry out in pain and refuse to use the limb, and also protect it by holding it with the elbow flexed and the forearm pronated. Now working our way into the anterior arm. So you will make an incision with your scissors through the pec major tendon here and see if you can separate these three muscles out. The biceps brachii with the long head and the short head, the coracobrachialis, named because of its attachment to the coracoid process, and the brachialis muscle. The long head of the biceps will actually, via this really long tendon, pass deep to the transverse humeral ligament and then attach to the supraglenoid tubercle of the scapula. This tendon will be traveling through a region called the intertubercular sulcus, just deep or posterior to the transverse humeral ligament. You should be able to find the musculocutaneous nerve here coming from the lateral cord of the brachial plexus as it pierces the coracobrachialis muscle. This, remember, is the nerve that innervates the three muscles in the anterior arm. If you follow this nerve far enough, you're going to see after it gives off all of its muscular branches, it'll continue along distally as the lateral cutaneous nerve of the forearm. Look at the brachialis muscle in your dissection. You're going to find it deep to the biceps brachii muscle. It'll attach on the anterior surface of the distal part of the humerus and on the coronoid process of the ulna. Find the median nerve here where it comes off the brachial plexus, and note again how this part of the brachial plexus forms the letter M, made up by the musculocutaneous nerve, the median nerve, and the ulnar nerve. It looks like the letter M. The ulnar nerve will actually be passing along here and then posterior to the medial epicondyle of the humerus. You should also very easily be able to find the brachial artery, as you've already identified all these nerves. The brachial artery is the continuation of the axillary artery up here, and now we call it the brachial artery as of here. It begins just at the inferior border of the teres major muscle, and it'll end approximately the level of the elbow when it then divides into the radial and the ulnar arteries. Let's have a look at that on a little diagram. Here we go. So here's the axillary artery, there's the teres major. Now it's called brachial artery, gives off the Profunda Brachii artery here, which passes posterior to the humerus, and here's the brachial artery, and then it divides into the radial and ulnar arteries. But on its way down, it gives off several collateral branches. Here are the superior and inferior ulnar collaterals. The superior ulnar collateral goes posterior to the medial epicondyle, and it then anastomoses with the ulnar recurrent arteries, the anterior and posterior, coming down here from the ulnar artery. On the other side, you have the radial collateral artery and the radial recurrent arteries. Now looking at this picture from the Moses et al. Clinical Gross Anatomy Atlas, we can recall some of our innervation and our muscles. Here's the coracobrachialis muscle. Here is the musculocutaneous nerve. There's the short head of the biceps that will be attaching to the coracoid process. Here again is the musculocutaneous nerve. Coming off of the brachial artery, here is the deep artery of the arm, the Profunda Brachii artery. Here's your ulnar nerve. And here's the median nerve right next to it. Brachial artery continues along here. Here would be the medial cutaneous nerve of the forearm. Here's the brachialis muscle, which would be deep to the biceps, which has been pulled aside. See, here's the short head of the biceps. And here's the coracobrachialis. And here's the long head of the biceps. On the radial side, here's the radial nerve. And as a preview for the posterior compartment of the arm here, we can see a little bit of the lateral head of the triceps brachii muscle poking through. Working our way distally down the arm, we're going to come to your cubital fossa. Cubital fossa actually comes from Latin because cubitus means elbow and fossa is a depression. So we're going to be talking about the contents of this region here. Clinically, it's important because it contains some superficial veins that we have probably all encountered as the victims of venipuncture. But also we have some large nerves like the median nerve and also the brachial artery that passes through here just before it then ends up dividing into your radial and ulnar arteries. A few things everybody should know are the boundaries of the cubital fossa. The lateral boundary is formed by the brachioradialis muscle right here. The medial boundary is formed by the pronator teres muscle. Well, guess what that does? Yes, it pronates the forearm. The superior boundary is actually an imaginary line connecting the medial and lateral epicondyles of the humerus. The superficial boundary is going to be the roof that is going to be formed by antebrachial fascia, so fascia of the forearm, and also reinforced by the aponeurosis of the biceps brachii, so the bicipital aponeurosis. And the deep boundary, so the floor of the fossa, will be formed by the brachialis muscle, look over here on the right side, and the supinator muscle, which is one of the muscles that helps you supinate. The strongest supinator on a side note is actually your biceps though. So find your biceps brachii tendon in the cubital fossa first, and cut it and reflect the bicipital aponeurosis to the medial side. Find and follow your median nerve and brachial artery into the cubital fossa, here with a little more contents, and here on the right side the area is a little cleared out, and pick out any fat that actually might be lying around in there which is obstructing your view. Fat can always be removed if it's in the way. And make sure you observe and recall the importance of the relationship of the structures to each other in the cubital fossa. Biceps brachii tendon is going to be lateral. The brachial artery is going to be intermediate. Median nerve is medial. Also note that the bicipital aponeurosis is superficial to both the artery and the nerve I just mentioned. The good thing is that it's deep to the veins that are passing through the cubital fossa, so it can provide some, but actually limited, protection for the deeper structures. Here's the cubital fossa in a cadaveric dissection. Here's the biceps brachii muscle. Here's the brachialis muscle. The lateral cutaneous nerve of the forearm, so the termination of the musculocutaneous nerve is right here. The tendon of the biceps brachii is here. Here is the ulnar artery. Here is the radial artery. So this here is the brachial artery coming all the way down here. Here's one of your recurrent, or actually collateral arteries up here, the inferior ulnar collateral artery. Here's the median nerve going medial through the cubital fossa. And here's the brachial artery, which is intermediate. All of this muscle here is the brachioradialis, actually already a forearm muscle. And we'll also discuss the rest of the muscles and structures as we move on into the forearm in the next segment. Let's do a quick little review here with Anatomy TV. We have here the Biceps Brachii. We've removed actually part of it. There's the nerve that pierces the coracobrachialis, which is the musculocutaneous nerve. It is a terminal branch of the lateral cord of the brachial plexus. You can see it right here. Here's the muscocutaneous. The terminal branch would be the lateral cutaneous nerve of the forearm. That's the brachialis, and the muscocutaneous nerve descends on top of that. We follow it, and here, as I said, the lateral cutaneous nerve of the forearm, also called lateral antebrachial nerve. So this nerve has both muscular and cutaneous parts. Remember here, the median nerve gets contributions from the medial cord and the lateral cord. It runs directly deep to the coracobrachialis and courses with the brachial artery, and so does the ulnar nerve, which descends down and eventually crosses over the brachial artery to pass under the bicipital aponeurosis directly next to the arteries. There is the ulnar nerve with the brachial artery, and the brachial artery is right in the middle of the ulnar nerve and median nerve. And then the ulnar nerve goes posterior to the medial epicondyle of the humerus. So you don't hit your funny bone, you actually hit your ulnar nerve. Let's keep looking at the anterior aspect. The brachial artery is named so after the axillary artery passes the teres major. It's going to be right here. It is straddled by the median nerve and the ulnar nerve. The ulnar nerve is posterior then, and the medial nerve goes anterior. The first branch of the artery is going to be the Arteria Profunda Brachii, or the deep artery of the arm. It's quite a unique situation because we also see something quite similar in the leg. There's a deep artery of the thigh there. And so here's the deep artery of the arm. So the Arteria Profunda Brachii comes off the brachial artery here and runs on the posterior side of the humerus. This artery will join the radial nerve in the radial groove, as you can see right here. And soon the radial recurrent comes off and joins the Profunda Brachii artery up here. And let's not forget that we have a couple of ulnar collateral arteries highlighted. There is the superior ulnar collateral artery, not indicated here is the inferior ulnar collateral artery. Not that bad though. Important, the superior ulnar collateral artery will then anastomose down here with what is called the posterior ulnar recurrent artery. And then there's also an anterior ulnar recurrent artery which anastomoses with the inferior ulnar collateral artery. Here's the radial artery on the radius and the ulnar artery on the ulna. Off the ulnar artery is this tiny little branch which is called the common interosseous artery. Then you have an anterior interosseous and a posterior interosseous artery, which run respectively on the anterior and posterior aspects of the interosseous membrane, which is between the radius and the ulna. And these arteries then travel all the way down through the forearm and into the hand. Let's have a look at some veins. Here's the cephalic vein. You can often see it when people are working out, pump and iron. Cephalic vein, it's named so because it's traveling towards the head, or cephalad. It's most lateral on the arm. This continues all the way up on the lateral aspect and joins the axillary vein up here. The most medial vein is going to be the basilic vein. You can see it here again. It then helps form the dorsal carpal venous arch that goes up on the ulna, winds around, goes more medially at the elbow, is joined by another vein here, the median cubital vein, which connects the cephalic vein and the basilic veins. It's a really important vein. It's a high-yield vein because of this venipuncture that often happens in the cubital fossa. This vein continues upwards and becomes the axillary vein. Cephalic vein drains into the axillary vein. Whenever you have an artery running in one direction, you often have a vein, or nearly always have a vein or veins running in the opposite direction. Here's the ulnar vein with the ulnar artery, anterior interosseous vein, anterior interosseous artery, and so on and so forth. Here's the posterior interosseous vein and artery, radial vein, and the recurrent arteries and veins. Because we have so many parallels between the arteries and veins, very often we will ask of you just to go ahead and remove those veins.